Dr. Turner and I were the first in the world to do an Essure reversal in 2007, and we reported the first Essure reversal baby in 2009. This was widely covered in the press. When I first thought about reversing an Essure, I realized that I needed to look in the available literature to see what operations had been used to repair blockage of the fallopian tube where it enters the uterus. What had been tried were various techniques to cut a hole in the uterus and sew the undamaged part of the tube into the hole. The results in an article of the Journal of the American Fertility Society involving 16 doctors and 285 patients using the technique of cutting a hole and putting the tube in the hole. 8 of the doctors did not have a single live birth. In the 285 patients, the term birth rate was 11%, 1 out of 10. It seemed to me there had to be a better way that did not require patients to deliver only by cesarean section, because cutting into the uterus weakens it to the point where the stress of labor can rupture the uterus. Spontaneous rupture of the uterus in a patient not in labor has been reported using this technique. We have developed a way that does not involve cutting the uterus by first carefully and completely removing the Essures microsurgery, dilating the natural opening where the tube goes into the uterus, and sewing the tube in its natural hole from the outside using a special needle that I developed. This needle is like a sewing machine with only one moving part. This first picture shows the suture being attached that will pull the tube into the uterus. The second picture shows the suture being threaded into the needle that has been hooked into the inside of the uterus, and the last drawing shows how the suture pulls the tube into its natural opening without weakening the uterus. These procedures do not work as well as other reversal types. For Dr. Turner and myself, it has been a constant effort to improve from the 20 to 30% that we have seen in the 230 cases so far. About a year ago, we redesigned the needle you see in the picture, and the tubes are going deeper into the uterus, and the dye tests are better.